It is amazing because the LUCENT program has several parts. LUCENT 1 is induction, LUCENT 2 is maintenance until 1 year, and LUCENT 3 until 4 years. So, like mimetize the way that we are treating ulcerative colitis patients. So it is very useful. So, and it was shown by Lucent one that after induction, it is very important to get endoscopic remission or improvement and histoendoscopic mucosal improvement. And this endpoint is related with outcome at 1 year. And regarding hospitalizations and surgeries, it is amazing to see that in LUCENT 1 program, when compare the active drug, that is Mirikizumab, with placebo, we have a difference, a huge difference between two important outcomes that several times we are looking for. Hospitalizations and surgeries, and we have decrease of hospitalizations and surgeries during the LUCENT 2 when compared with placebo in the active arm. But it is very curious to see that over time, until 4 years, those that respond or reached remission after 1 year, no surgeries, and hospitalizations were reported over 4 years, translating the importance of Mirikizumab as a therapeutic arm in ulcerative colitis, because at the long term, and we are speaking at a long term, Mirikizumab is able to reduce hospitalizations and surgeries. So it is very important, as I said, because no hospitalizations and surgeries in active arm over time, and we have a period of 4 years. It is amazing. That is, we are changing the outcome and the natural history of ulcerative colitis with Mirikizumab. Yes, this achievement is very important because we are changing, we are modifying the disease course of ulcerative colitis, decrease the hospitalization and surgery. And hospitalizations and surgeries are related with quality of life of our patients, particularly surgery, because surgery in ulcerative colitis is associated with severe complications. Usually, I say that after surgery, we have a new disease in ulcerative colitis. We have a disease before surgery and a new disease after surgery, and with several number of complications and morbidity associated. So if you have a drug that is able to modify the disease outcome in surgery, it is amazing for our patients. Yeah, it is important because if you have a reduction only after induction or after 1 year, we are not changing the disease course. If you have data depicting the reduction of hospitalization and surgery over time, we are doing an excellent job for our patients, modulating the disease course and decreasing the disability of ulcerative colitis disease. Yes, I think so. Mirikizumab has been depicting during these years that is able to reduce the hospitalizations, reduce surgeries, is able also to induce disease clearance, a new concept that is patients reached uh, 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 histological remission, endoscopic improvement or remission, and no symptoms, and is able to induce disease clearance in a high proportion of patients after 1 year, roughly 60% of the patient, and is able to keep this patient over time in disease clearance or in a stringent disease clearance that is endoscopy zero, histological remission, and no symptoms. So it is a great achievement because we know that is a durable effect, first point, and second point, this is related with several outcomes, including endoscopic findings over time and also symptoms, need of corticosteroid, need of immunomodulators, need of switching or swapping. So, with this drug, we are increasing the bar. I like to emphasize that mirikizumab is effective and has a high safety profile and is able to modify at the long term the ulcerative colitis disease course.